thinking about a recommendation for ABA versus a recommendation for occupational therapy or another type of intervention, typically when a parent comes who has been referred for ABA therapy, they are oftentimes they are experiencing behavior issues with their child. So the child is either getting in trouble at school or they're having difficulty with them at home, and someone has made this recommendation for behavioral therapy, and or they have received an autism diagnosis, and the traditional recommendation for an autism diagnosis is typically going to include speech, OT, and ABA. At our clinic, we do not provide specifically ABA. We follow a more developmental approach to intervention, looking at remediation versus compensation. So when we are thinking about behavior problems, we go back to this idea of, okay, is it the symptoms? So my child is getting in trouble at school, my child is hitting, my child is biting, my child is screaming. From a behavioral standpoint, we see the behavior and we want to stop the behavior, or we want to replace the behavior. It might not be that there's behavior things going on, but let's say there's a learning challenge. The child is not learning their alphabet. Their child is not learning, is not yet reading, is not picking up on some of these early learning skills. A behavioral approach is child doesn't know numbers, so we train numbers. Child has a behavior that we don't like, so we want to replace the behavior or we want to eliminate the behavior. From a developmental standpoint, what I would be looking at is more of like, well, why are we seeing this? Why is the child not learning their letters? What is going on that is creating this negative behavior? So from a developmental, more bottom-up approach, instead of training the behavior away, replacing the behavior, when the child does this, we want them to do this. Instead, we're going to take a look at, well, what's going on? Take a look down the developmental path, back up as far as we can to looking at the way that the things that need to come online, that need to organize in order for later development to happen, we want to take a look at that. So for instance, let's take a look at the way that the skin is processing. Are we able to intervene with tactile stimulation, tactile information in order to organize the body? Are we able to look at the vestibular system? How is the brain processing that information? And what is it about the behavior? Is the behavior the problem, or is there more of a fight or flight, protection and survival response going on? Is this brain doing everything that it can do to survive because one of its other systems is not processing optimally? If we are seeing meltdowns, then from a behavioral standpoint, we might put into place some compensations, positive rewards, negative rewards, and not to not do one or the other. It's not a one or the other. It's not a if then you can't do this, but to consider while we're putting in some behavior modifications, are we also looking at the various systems that can be feeding into this emotional dysregulation? And so I think that one of the ways, again, to better understand this is just in your own body and understanding, even though you are not delayed in your development, what needs to happen in order for you to melt down, in order for you to, now as an adult, hopefully you're not hitting your friend, but to want to very specifically not because you know better, but have you ever gotten mad enough that you've wanted to clench your teeth, or you wanted to clench your fist, or that you have shaken the steering wheel or screamed out loud? What did it take in order for that to happen? And typically it has to do with your system getting overwhelmed. You probably noticed in those moments that you were hotter than normal, that you were, if you've been hungry, there's all these things that play into that. If you've ever, either you're getting sick or you're coming off of being sick, you might find that you're more likely to dysregulate. You're more likely to emotionally melt down in the before or the after of that, because your system is tired. You're focusing on something else. And so when people ask about ABA or why do we not do ABA here at the clinic, the main reason that we don't do ABA at the clinic is because other people are doing ABA in our community and they're doing a great job. And what we offer is something supplementary, something different, where our OTs and our SLPs and even our audiologists, where our entire team is looking at the systems that aren't going to be looked at from a behavioral standpoint, and looking at, okay, what can we do with the tactile system? What can we do with the auditory system? What can we do with the visual system? What can we do with the vestibular and the proprioceptive systems? What can we do with the proprioceptive system in order to support a more regulated system so that you aren't seeing behaviors, negative behaviors, so that you're not seeing difficulty with learning? In some instances, children truly have something going on that is the reason why they're not learning. They have a true learning disorder. But in most cases, it is because their brain is busy doing something else. Their brain is in more of a protection and survival framework. They're operating from protection and survival, from fight or flight. They are perceiving more danger and stress and more of the need to protect themselves than they are able to then be successful in the environment for some reason. So taking a look at that and seeing what can we do from the bottom up to support emotional dysregulation, while either in conjunction with setting up some consequences or positive reinforcement or various behavioral techniques to compensate for these behavior problems while we are building up the foundation, supporting the system so that it regulates itself and it's able to function better.